All right, today we're going to decode three viruses that have pretty much shaped our world: the common cold, the flu, and of course, COVID-19. They're a constant part of our lives, right? But do you really truly know what sets them apart?
We've all been there. You wake up, you feel that little tickle in your throat, and immediately the guessing game begins. Is this just a quick bug that'll be gone by tomorrow, or am I about to be completely knocked out for a week? Let's get some answers.
So before we dig into the individual culprits, let's just zoom out for a second and appreciate the sheer scale of this problem. We're not just talking about a few sniffles here and there. These infections are a massive global health challenge.
Take a good look at this number: 3 million. That's not just a random figure. According to the World Health Organization, that's roughly how many people die every single year from lower respiratory tract infections. To put that into perspective, it's the fourth leading cause of death on the entire planet.
Okay, so what exactly is a respiratory tract infection? Well, it's really just a broad term for any bug that hits our breathing passages. We split them into two main types: upper infections, that's what you'd think of as the common cold, affecting your nose and throat, and then there are the lower infections, which go deeper into your lungs and can cause serious stuff like pneumonia.
All right, now that we've got the background covered, it is time to meet our three main suspects. They might operate on the same turf, our respiratory system, but as you're about to see, they are very, very different characters.
First up, the common cold. And get this, it's not just one virus, it's a huge family of over 200 of them, with rhinoviruses being the usual suspect. Then you've got influenza, the flu, which comes in a few different types and is, famous for its seasonal attacks. And finally, the newcomer that really needs no introduction, COVID-19, which is caused by the SARS-CoV-2 virus.
Now, this is probably the section you've been waiting for. How can you actually tell these things apart when you're feeling awful? We are about to put their symptoms side by side and decode the clues that our own bodies give us. This chart does an amazing job of organizing the chaos of symptoms. Now, I know it looks a little busy at first glance, but don't worry, we're going to use it as our guide. For now, just focus on those columns for the cold, the flu, and COVID-19, and let's pull out the biggest differences.
The first big clue is all about how it starts. A cold, it tends to creep up on you, right? It gets gradually worse over a couple of days. The flu, on the other hand, is famous for its sudden dramatic entrance. I mean, you can feel totally fine 1 minute, and then bam, it hits you like a truck a few hours later.
Next up, where do you feel it the most? With the cold, the action is almost entirely above your neck. We're talking sneezing, a stuffy nose, sore throat. But with the flu and COVID-19, it's a full-body experience. Think high fever, deep muscle aches, and this crushing fatigue that makes just getting out of bed feel absolutely impossible.
And of course, there's that one telltale sign that really became a hallmark of early COVID-19 infections. Look, a really bad cold can dull your senses, for sure. But that sudden, complete loss of taste or smell, that's a very specific clue that points strongly towards COVID-19.
So we know what we feel, but why? Why do these viruses create such totally different experiences in our bodies? To answer that, we've got to go a little deeper and look at how they actually work on a biological level.
This right here explains why the flu is such a pain, year after year. The virus is a master of disguise. Through something called antigenic drift, it makes these little tiny changes every season, kind of like it's just changing its hat. That's why we need a new flu shot every year. But sometimes it does something called an antigenic shift, which is like a complete costume change. When that happens, our immune systems have no idea what they're looking at, and that is when we can see a major pandemic.
In severe cases of COVID-19 and the flu, one of the biggest dangers isn't actually the virus itself. It's our own body's reaction to it. It can trigger something called a cytokine storm. Basically, your immune system panics. It just goes into total overdrive, releasing this flood of inflammatory signals that, instead of helping, ends up creating this vicious cycle of damage. It can cause massive inflammation in the lungs and other vital organs.
Okay, so that's the science behind the attack. Now, let's talk about our defense. What can we actually do to protect ourselves, and what are our options if we do get sick?
Our first line of defense is actually pretty simple stuff, but it is incredibly powerful. It all comes down to the basics of good hygiene: washing your hands often, covering your mouth when you cough or sneeze, keeping indoor air fresh, and wearing a mask to stop the spread if you're feeling under the weather. But when it comes to the flu specifically, the message from public health experts could not be clearer. Nothing beats the vaccine. Getting your flu shot every year is the single most effective thing you can do to prevent getting sick and to avoid serious complications.
Have you ever wondered how they even make a new flu vaccine every single year? It is this absolutely fascinating global race against time. Scientists all over the world are constantly tracking new flu strains. They use all that data to predict which ones are going to be the most common, and then, in many cases, they grow huge amounts of the virus inside sterilized chicken eggs to produce the vaccine. That's right, it's often one egg for one dose of the vaccine.
Now, if you do get sick, the treatments are really different depending on what you have. For a common cold, it's all about just managing the symptoms. Rest, drink plenty of fluids, maybe take some pain relievers. For the flu, antiviral drugs can really help, but here's the catch. You have to start them within the first 2 days. And for COVID-19, we now have specific antivirals for people at higher risk and some powerful steroids for the really severe cases.
But here's the thing. This battle is never really over. These viruses are constantly changing, which means our strategies to fight them have to keep evolving right along with them.
The key thing to get is that viruses, especially ones like influenza and COVID-19, are not perfect. They make tiny mistakes when they copy themselves, and we call those mistakes mutations. Now, most of them don't matter, but every once in a while, a mutation creates a new variant, like we saw with Delta or Omicron, that's way better at spreading or at dodging the immunity we've built up. It's a constant cat-and-mouse game.
And it is so critical to remember that for a lot of people, just clearing the initial COVID-19 infection isn't the end of the story. The condition we now call long COVID can leave people with these debilitating, long-term symptoms like chronic fatigue and brain fog. It's a stark reminder that the impact of this virus can be really profound and lasting.
So what's the ultimate takeaway here? It's that understanding these invisible enemies, how they work, how they spread, how our bodies fight back, that is our most powerful tool. This knowledge empowers every single one of us to make smarter decisions, not just for our own health, but for the health of everyone around us.
And that leaves us with one last really fascinating thought. I mean, we've gone from the simple advice of washing our hands to targeted antivirals and revolutionary mRNA vaccines in just a few generations. So, as our scientific toolkit gets even more advanced, what comes next? A universal flu vaccine that works against every strain? AI that can predict the next pandemic before it even starts? It is an exciting and honestly a critical question for our future.